हेलो एवरीवन एंड वेलकम बैक टू डॉक्टर आसिफ लेक्चर्स। आप देख रहे हैं पैथोलॉजी की प्लेलिस्ट जो हम मीडियम रॉबिन से कर रहे हैं और चैप्टर नंबर 10 जो कि ब्लड वेसल्स की पैथोलॉजी है उससे आज टॉपिक डिस्कस करेंगे एन्यूरिज्म्स एंड डायसेक्शन। नाउ एन्यूरिज्म्स एंड डायसेक्शन दे आर important because they are clinically very relevant and at times they can be fatal. इन जनरल टर्म्स अगर मैं बात करूं तो एन्यूरिज्म का मतलब होता है आउट पॉकेटिंग. सो इफ दिस इज द नॉर्मल ब्लड वेसल जो ऐसे पाइप की तरह चलती है एंड इफ देयर आर आउट पॉकेटिंग इन द वॉल ऑफ द ब्लड वेसल थिंग्स लाइक दिस एंड देयर कैन बी मल्टीपल रीजंस फॉर दैट. फॉर एग्जांपल अगर ब्लड वेसल की वॉल थिन हो गई है, उसमें कोई इशू है, यानी स्मूथ मसल कम बन रहा है या डेग्रेडेशन हो रही है स्मूथ मसल की, या कोई इन्फ्लेमेशन है, देयर कैन बी मल्टीपल रीजंस जो भी हम डिस्कस करेंगे. बट आउटकम ये होता है कि देर आर आउट पॉकेटिंग्स इन द ब्लड वेसल. सो दीज आर कॉल्ड एन्यूरिज्म्स. अच्छा, एन्यूरिज्म्स आर प्रोन टू रप्चर. ऑब्वियसली आर्टरीज जो हैं दे आर हाई प्रेशर ब्लड वेसल्स, तो दे आर ऑलवेज प्रोन टू रप्चर. और रप्चर होगा तो ब्लीड होगा एंड डिपेंडिंग अपॉन किस एरिया में ब्लीड हुआ है उसके कॉन्सिक्वेंसेस उसी तरह होंगे. फॉर एग्जाम्पल अगर ब्लीड होता है बेस ऑफ द ब्रेन में जो कि सर्कल ऑफ विलिस है, वहाँ एन्यूरिज्म्स काफ़ी कॉमन भी है वैसे. तो ज़ाहिर ब्रेन में ब्लीड हो रहा है, इंट्राक्रेनियल ब्लीड, सो देयर विल बी सीरियस कॉन्सिक्वेंसेस. ओके, एंड देन देयर इज अनदर टर्म विच इज कॉल्ड डायसेक्शंस. डायसेक्शन वर्ड का मतलब ही होता है काटना, है ना. सो दिस इज लाइक अ टियर फॉर्मेशन इन द वॉल्स ऑफ द ब्लड वेसल्स, यूजुअली द हाई प्रेशर ब्लड वेसल्स सच एज एओर्टा. तो ये दो टर्म्स आपको एट द आउटसेट इनके मतलब क्लियर होने चाहिए कि एन्यूरिज्म का मतलब है आउट पॉकेटिंग, डायसेक्शन का मतलब है कटना, बाकायदा जैसे नाइफ से काट रहा है कोई अंदर से ब्लड वेसल्स को. ओके, अब वन बाय वन इनको डिस्कस कर लेते हैं. एन्यूरिज्म्स आर कॉन्जेनाइटल, सो यूजुअली दे आर कॉन्जेनाइटल बट दे कैन बी एक्वायर्ड. डायलिटेशन ऑफ द ब्लड वेसल्स और द हार्ट एज वेल. ये अक्सर लोगों को नहीं समझ में आती बात, बट हार्ट भी अगर डायलेट हो जाए तो उसको भी कार्डियक एन्यूरिज्म कहा जाता है. सो ट्रू एन्यूरिज्म्स इन्वॉल्व all the three layers of the artery, including tunica intima, media, and adventitia, or the attenuated wall of the heart. These include atherosclerotic aneurysms, congenital vascular aneurysms, और फिर एक कैटेगरी होती है false aneurysm की. They result when the wall defect lead to formation of the extravascular hematoma that communicate with the intravascular space. अब मैं ये आपको डायग्राम पे समझाता हूँ. So if you look at this diagram, this is a normal blood vessel. Okay, ये इस blood vessel का lumen है, इसमें से blood गुजर रहा होगा. The innermost layer is the tunica intima, then tunica media, and then tunica adventitia. Right? अगर तीनों walls, आप देखें ये जो एन्यूरिज्म बन रहा है, ये जो आउट पॉकेटिंग हो रही है, this includes all three layers. अगर इस तरह का सिनेरियो है, this is called a true aneurysm. इसमें आप देख रहे हैं कि एक साइड ऑफ द ब्लड वेसल इज ओके बट एन्यूरिज्म इज अफेक्टिंग ओनली वन साइड, सो सच एन्यूरिज्म इज नोन एज सेक्युलर एन्यूरिज्म. अगर बोथ द साइड्स आर एक्सपेंडेड, एन्यूरिज्म दोनों तरफ बन रहा है, यहाँ भी आउट पॉकेटिंग हो रही है, यहाँ भी आउट पॉकेटिंग हो रही है. सो इफ इट्स ऑन द बोथ साइड, दिस इज कॉल्ड फ्यूजिफॉर्म. राइट, नाउ लुक एट दिस फॉर एग्जाम्पल. सो in this type, there is a tear in the blood vessel, and this is the tunica adventitia, but tunica intima, tunica media, and tunica adventitia, they are kind of torn, और उसमें से ऐसे blood बाहर चला गया और एक aneurysm बन गया है. This is not actually a true aneurysm, but this is because of the blood which has leaked in there. Blood यहाँ जमा हो गया, hematoma बन गया. This is called a false aneurysm. Okay, and a dissection is a small tear. There is extravasation of blood. There is a tear in the tunica intima, and the blood start accumulating between the layers. So that is what we call the dissection. Okay, so ये diagram बड़ी important है. Normal blood vessel to true aneurysm की दो categories, secular aneurysm and fusiform aneurysm दोनों तरफ. Then there is false aneurysm जिसमें सारी layers जो हैं वो rupture हो गई हैं and there is extravascular connective tissue के साथ blood hematoma बन गया है. And if there is only in the tear in the intima, you start getting dissection. Okay, so true and false aneurysms इस वक्त आपको याद रखना है. Now, examples of ventricular rupture contained by the pericardial adhesion and leaks at the junction of the. So ये false aneurysm की example दे रहे हैं कि अगर tear होगा blood बाहर जमा हो जाएगा. And then there is a term called dissection. Dissection में ये हो रहा है कि pressurized blood gains entry to the arterial wall through the surface defect such as tunica intima. Aneurysms in dissection are important causes of stasis, क्योंकि blood यहाँ जमा होगा तो thrombosis हो सकती है, and if it ruptures then there can be bleeding. Okay, so एक major जो आपको difference याद रखना है ना, इस तरह के एन्यूरिज्म में, विच इज़ अ फॉल्स एन्यूरिज्म बिकॉज ऑफ हीमाटोमा, एंड इस तरह के ब्लीडिंग में कि यहाँ पे इंटिमल टियर है एंड द ब्लड इज काइंड ऑफ अक्यूमुलेटिंग विद इन द लेयर्स ऑफ द ब्लड वेसल. ओके, Now, aneurysms can be classified by shape. जैसे मैंने अभी नीचे आपको बताया, they can be, secular on one side, they can be fusiform. So, all these terminologies you should understand. Now, what is the pathogenesis? ये aneurysms होते क्यों हैं? Now, arteries are dynamic tissues and must withstand constant mechanical stress because they are high pressure system. Heart से जब blood pump होता है वो arteries में ही आता है. So, they have a very high blood pressure. So their design is in the way that they have to withstand the high pressure. Aneurysms occur when there is alteration in the smooth muscle or the extracellular matrix composition. So either there is inadequate or abnormal connective tissue synthesis. So there are diseases in which the connective tissue synthesis is abnormal and therefore the bulging of the vessel wall happens. And there are several inherited diseases reported. They provide insights into the type of abnormalities that lead to aneurysm. As discussed earlier, TGF-beta regulates smooth muscle proliferation. ये मेरी पिछली वीडियो में मिलेगा आपको. And matrix synthesis. Thus, any mutation in TGF-beta receptor और ये TGF-beta signaling अगर disturb होती है तो smooth muscle proliferation नहीं होगी and there will be chances of aneurysms. Okay? फिर एक disease है which is called the Marfan syndrome. There is defective synthesis of scaffolding protein which is fibrillin. It leads to increased bioavailability of TGF-beta in the aortic wall with subsequent dilatation due to dysregulated signaling. So TGF-beta की signaling अगर underpinned है या over expressed है, दोनों ही condition में there can be problems in the TGF-beta signaling and there can be aneurysms. Okay? Then defective type 3 collagen synthesis leading to aneurysm formation is also a hallmark of type 4 Ehlers-Danlos syndrome, because in this Ehlers-Danlos syndrome you don't have collagen which is part of the connective tissue. So either there are issues with the, because strength क्या है vessel wall की, जो ये सारी यहाँ पे strength है, that is because of two things. Number one, the smooth muscle cells, and number two, the extracellular matrix या connective tissue. So हर वो disease जिसमें smooth muscle cell में problem है या connective tissue में problem है, it can lead to aneurysm formation because जो vessel wall है वो weak हो जाएगी. ओके, तो एक जनरलाइज कॉज तो ये है. अगर आपसे कोई पूछता है कि एनेरिज्म्स क्यों होते हैं, सो नंबर वन, देयर इज इनएडिक्वेट और एबनॉर्मल कनेक्टिव टिश्यू सिंथेसिस. Another cause that you should know is excessive connective tissue degradation. पहले सिनेरियो में connective tissue बन नहीं रहा था appropriately, और इस सिनेरियो में connective tissue degrade हो रहा है more than it should have usually been degraded. So अब ये ज़्यादा degrade हो रहा है. Okay? Increased matrix metalloprotease expression, for example, by macrophages in atherosclerosis, for example, it starts degrading the extracellular matrix. So this is another cause. Then third general phenomena that you should remember is loss of smooth muscle cell or any change in the smooth muscle cell phenotype. Now, atherosclerosis की वजह से ये होता है कि there are changes in the smooth muscles and therefore, histologically the smooth muscle and the extracellular matrix change and there is weakening of the vessel wall. So, either there is inadequate formation of the connective tissue, there is destruction of the connective tissue, more destruction, and there are changes in the smooth muscle cell architecture. Okay? तो ये एनेरिज्म को बिल्कुल ईजीली समराइज कर दिया है सारे सिनेरियो को. Now the two most important predisposing conditions for aortic aneurysm, यानी वो aneurysm जो aorta में होगा, are atherosclerosis and hypertension, both very common in our countries, India, Pakistan, Sri Lanka, because of dietary habits and stuff. Also in US, West की भी diet कोई ऐसा नहीं है कि बहुत healthy diet है. They also face a lot of problems with atherosclerosis and hypertension. So these are two very common predisposing factors for aneurysm. So atherosclerosis is a dominant factor in abdominal aortic aneurysm, while hypertension is associated more with ascending aorta. So ये इनकी location wise आपको चीज़ याद होनी चाहिए. Other conditions that weaken the vessel wall lead to aneurysm include trauma, any inflammation of the blood vessel, congenital defects, infections, and they can also lead to aneurysms called mycotic aneurysms. They may result from embolization of a septic embolus, यानी कहीं पे कोई infection हुआ, वो travel करके vessel wall में चला गया, वहाँ infection हुआ, and then mycotic embolus. Extension of an adjacent suppurative process, कहीं साइड में inflammation चल रही है, उससे blood vessel affect हो गई, that sort of thing. Okay? A predilection of the spirochetes for the vasa vasorum of the ascending aorta. आपको vasa vasorum पता होना चाहिए कि if this is your heart, यहाँ से जो ascending aorta निकल रहा है, इस ascending aorta को जो blood supply मिलेगी, that is called vasa vasorum. And some spirochetes have special predilection for infecting this vasa vasorum. Okay, and this results in obliterative endarteritis. और जब ये बिल्कुल ब्लॉक हो जाएगी vasa vasorum, तो blood supply to aorta will be affected, and this will lead to weakening of the vessel wall, and aneurysms will form. Okay. So infection से भी ये चीज़ हो सकती है. Now we have to specifically talk about some locations and then their consequences. So for example, if aneurysm happens in abdominal aorta, what happens? If it happens in thoracic aorta, then what are the consequences? So let us talk about some specific sites which are very important and clinically relevant. So starting from discussion from aortic aneurysm, जो कि abdominal aorta में, you should know different parts of aorta, by the way. So there is your heart, and there is ascending aorta, then there is arch of aorta, then descending aorta which goes through the thorax is called the thoracic aorta, then the one which goes to the abdomen is called the abdominal aorta. Okay, so right now we are talking about abdominal aorta. So aneurysms occurring as a consequence of atherosclerosis are very common in abdominal aorta. Okay, abdominal aortic aneurysm, also called AAAs, occur more frequently in men and in smokers, and they usually develop after the age of 50, so they rarely develop before 50 years of age. Atherosclerosis is a major cause of abdominal aortic aneurysm, but other factors clearly contribute. और लेकिन एक बात आपको ये पता होनी चाहिए कि अदर फैक्टर्स जो हैं वो कंबाइंड भी उनका इफेक्ट इतना नहीं है जितना आपको ये पता होनी चाहिए कि एथेरोस्क्लेरोसिस वाले एनेरिज्म एब्डोमिनल एओर्टा में ज़्यादा होते हैं. ओके, बट एनीवेज अदर फैक्टर्स क्लियरली कंट्रीब्यूट सिंस द इंसिडेंस इज लेस देन 5% इन मैन ओल्डर देन 60 डिस्पाइट ऑलमोस्ट यूनिवर्सल प्रेजेंस ऑफ एब्डोमिनल एओर्टिक एथेरोस्क्लेरोसिस. बताने की ये कोशिश कर रहे हैं कि हर किसी को जिसको एथेरोस्क्लेरोसिस है ज़रूरी नहीं है उसको एब्डोमिनल एओर्टिक एनेरिज्म भी होगा. इट्स ओनली लेस देन 5% of those who have atherosclerosis. Okay, in majority of the cases, abdominal aortic aneurysm result from the extracellular matrix degradation, which is mediated by the proteolytic enzyme, which is part of the pathogenesis of atherosclerosis. और आपको पता है जब extracellular matrix degrade होगा, then aneurysm may form because there is weakening of the vessel wall. Of note, smokers who develop abdominal aortic aneurysm tend to have more severe chronic obstructive pulmonary disease. So that's an association that they have found. Okay, you don't have to worry about it. Now, the clinical consequences. The clinical consequence of abdominal aortic aneurysm include obstruction. It can actually obstruct any vessel which is branching off from the abdominal aorta. For example, the abdominal aorta give branches to kidney. So, यहाँ अगर aneurysm बन जाता है, there may be blockage, iliac vessels, mesenteric vessels, and that can then lead to ischemia of the organ. So, obstruction is one problem. Embolism is another problem because there is atherosclerosis. So, the atherosclerotic plaque can detach off and travel anywhere, so that's an embolism. And then there may be impingement on adjacent structures, so for example compression. So if the aneurysm is large enough and that's a high pressure vessel, it will cause pressure effects nearby, so impingement of adjacent structures, an abdominal mass, and ultimately the most deadly one would be a rupture. So if it ruptures, there will be massive bleed and it can be a fatal hemorrhage, life-threatening hemorrhage. Okay, and if you talk about the risk for rupture of this aneurysm, it's related to the size. So which if you have an aneurysm in the abdominal aorta 4 centimeter or less in diameter, they almost never burst, while those between 4 and 5, 1% per year के chances हैं, and the risk goes very high, staggering high to 11% if it's 5 to 6 centimeter and 25% if it is more than 6 centimeters. So depends upon how big is the aneurysm. Okay, thus the aneurysms 5 centimeter in diameter or larger, they are managed surgically either by an open placement of a graft or endoluminal insertion of stents. So that has to be dealt with. Otherwise 5 centimeter से ऊपर आपको पता है कि rupture के dangerous chances हैं. A point worthy of emphasis is because atherosclerosis is a systemic disease, a patient with abdominal aortic aneurysm also is very likely to have atherosclerosis in other vascular beds. Obviously, you have to consider other parts, and you have to consider stroke and ischemic heart disease and all these stuff. Okay, atherosclerosis is not good. Right. Now a few points मुझसे अक्सर स्टूडेंट पूछ रहे होते हैं, सर ये रॉबिन्स पैथोलॉजी में जो ये वाले डब्बे आते हैं ना मॉर्फोलॉजी वाले, देखो भाई ये मुश्किल होते हैं, याद रखना, समझना भी थोड़ा मुश्किल है, लेकिन इनको एक दफ़ा पढ़ा ज़रूर करो। पॉइंट ये है कि इसमें कोई अगर इंपॉर्टेंट बात है वो हाईलाइट करके आपको अपने पास रखनी है, सारी डिटेल्स याद रखने की नहीं है, बट कुछ पॉइंट्स इंपॉर्टेंट भी हैं। सो एब्डोमिनल एओर्टिक एनेरिज्म टिपिकली अकर between the renal arteries, so that's the usual location, okay, and at the aortic bifurcation. So these are the, ये आपको याद रखने वाली बात है। Now inflammatory abdominal aortic aneurysms are distinct subtype characterized by periaortic fibrosis containing abundant lymphoplasma, so there can be severe inflammation. It is mediated by a few players. There is a subset of the inflammatory abdominal aortic aneurysm, and it is called IgG4 related disease. This disorder is actually characterized by marked fibrosis, and there is heavy infiltration of IgG4 expressing plasma cells, so that can also cause a variant of abdominal aortic aneurysm which is heavily infiltrated by immune cells, and there is fibrosis. Okay, then there is a mycotic category जो मैंने आपको ऑलरेडी बताया कि circulating microorganism can infect and they can cause mycotic aneurysms. ये बात हमारी अभी थोड़ी ही देर पहले हुई है, I think somewhere, yeah, the mycotic aneurysms. Okay, right. So after abdominal aortic aneurysms, which are very common because of atherosclerosis, let's talk about if aneurysms happen in thoracic aorta. So most commonly associated with hypertension, bicuspid aortic wall. So hypertension is a major cause there, okay, and the Marfan syndrome. Less commonly disorders caused by mutations in the TGF-beta, because मैंने आपको बताया TGF-beta is required for a smooth muscle proliferation. If it is not there, the proliferation is not there and things go wrong, okay. Respiratory and feeding difficulties can be a problem. There can be persistent cough because of this, pain, cardiac diseases, aortic dissection or rupture. Rupture always is the most dangerous complication of an aneurysm, right? Now once we have dealt with the aneurysms, let's talk about dissection. Aortic dissection occurs when the blood is placed apart the laminar planes of the media to form a blood-filled channel within the aortic wall. So the definition is very important to understand. So if we go back to this diagram, this one, so there is tearing in the intima and the blood is accumulated within the blood vessel wall. This is what is known as dissection. Okay, and now the problem with dissection is the fact that that blood vessels, which we are talking about, arteries, they are high pressure blood vessels. हर pulse के साथ इसमें एक high pressure beat है और कुछ ना कुछ blood यहाँ जाएगा. So it will keep on increasing in size, and the tear, just like a zipper, आप जैसे zip खोलते हैं ना, तो ये जो vessel wall है ये बड़ा होता जाएगा hematoma. That is a problem. Okay, right. So this development can be catastrophic if the dissecting blood ruptures through adventitia escape into the, so that can be a very, very fatal thing. Okay, and we will have a look at the diagram in a while to show you how dangerous it can be. Aortic dissection need not to be associated with aortic dilatation, and the older term dissecting aneurysm should be avoided. It has to be clearly called aortic dissection. It may occur in two age groups, men between 40 and 60 of age with antecedent hypertension, and younger patients with connective tissue abnormalities such as Marfan syndrome. Otherwise, this is the age group. Okay, dissections can be iatrogenic, such as आप arterial cannulation कर रहे थे या कोई diagnostic procedure कर रहे थे, interventional radiology का कोई procedure था, and you introduced a defect in the blood vessel wall, and because of that dissection happens. So it can be iatrogenic. Okay. Rare phenomena, rare scenario, pregnancy is also associated with aortic dissection. This typically occurs during or after the third trimester. So remember, this is important because there is hemodynamic stress throughout the body in a pregnant female. So dissection can be a complication. That's rare, but this still can happen. Okay. How does this happen? I've kind of actually told you. Hypertension is the major risk factor, and aortas in hypertensive pressure show narrowing of the vasa vasorum, और जब vasa vasorum वो blood vessels जो wall को supply कर रही है, अगर ये किसी भी वजह से narrow होंगी, block होंगी because of the high blood pressure, then ये जो wall area है इसको blood supply नहीं मिल रही, so the wall will become weak and there will be tears, aneurysms or chances of dissection will increase. तो एक ये इशू है. दूसरा फिर अगर कोई कनेक्टिव टिश्यू का प्रॉब्लम है सच एज मैरफन सिंड्रोम, एहलर-डायरनर सिंड्रोम, ये सारे प्रॉब्लम्स भी can lead to dissections. Okay, the trigger for the intimal tear, so that's the initial event. If this is your artery and tunica intima tears up, तो blood enter होना शुरू हो जाएगा. That's the initial. So intimal tear, tunica intima का tear is the initial event, and subsequent intramural hemorrhage is not known कि exactly कैसे होता है, but obviously वो जगह weak हो जाती है इस वजह से that actually happens. Okay, clinically what will happen? The clinical manifestations of dissection depends primarily on the portion of the aorta affected. The most serious complication of dissection involving the proximal aorta and the arch of aorta. और इसको जरा देख लेते हैं हम. Type A dissections, which involve the proximal part of the aorta, the proximal lesions, they involving the ascending aorta with or without involvement of the descending aorta. So this is type A characteristic. So there is ascending aorta involvement. Either the descending is involved or it is not involved, kind of thing. But ascending is definitely involved. Okay, these are called DeBakey type 1 or type 2. If the descending aorta is also involved, you see by the red patches here, this is DeBakey type 1, and if only ascending aorta is involved, DeBakey type 2. Okay, then there are distal lesions. They beyond the subclavian artery इनका origin होता है DeBakey type 3, so the initial part, the ascending aorta, is spared. Okay, the classic clinical symptom of aortic dissection is sudden onset of excruciating tearing or stabbing pain. ऐसा लगता है अंदर कुछ फट रहा है, रप्चर हो रहा है चेस्ट में किसी जगह या एब्डोमेन में, डिपेंडिंग अपॉन किस साइट पर है. The most common cause of death is rupture of the dissection into the pericardial or perular or peritoneal cavity. So imagine this is your aorta, very high pressure blood vessel, और अगर ये rupture होगा तो किस तेजी से hemorrhage होगा, it will be fatal. Common clinical presentation stemming from the cardiac involvement include cardiac tamponade or aortic insufficiency, and they lead to sudden death. In type A dissection, now remember what is type A dissection? Type A dissection is where the ascending aorta is involved. A for ascending, A for type A. Okay, easy to remember. Rapid diagnosis and institution of antihypertensive therapy coupled with surgical placement is mandatory, otherwise there are chances of rupture. However, mortality rate approaches 70% in patients who present with hemorrhage or symptoms related to distal ischemia, so it's a very high mortality disease basically. Okay, so that's all. Very important topic, aneurysms and digestion में कहने लगा था, dissection. So I hope you liked the video. If you did, please subscribe the channel, share the video with your colleagues, hit the bell icon. I'll see you in another video very soon. Stay blessed. This is Professor Asif Qureshi and you are watching Dr. Asif Lectures.